Dr. Anderson, thank you so much for joining us on MD Newsline podcast. Can you
Mhm.
please introduce yourself to our audience?
Absolutely. Thank you for having me. I'm Janeane Anderson. I'm an assistant professor in the College of Nursing at the University of Tennessee Health Science Center. That's in Memphis, Tennessee. I'm a breast cancer researcher and an all around woman's health and sexual health advocate.
And you presented some really interesting research at the conference this year. Can you please tell me a little bit about your work?
Yeah, this is my first time at the conference, and I was really excited to present on behalf of my team some initial findings related to recruitment and early enrollment for the Access Study. So, the Access Study is a 3-year industry sponsored study in which we're trying to explore upstream factors or socio-ecological factors that increase the likelihood for an advanced stage diagnosis. So that's stage 3 or de novo metastatic breast cancer among Black women and living in the Mid-South region. So the Mid-South region is Tennessee, Arkansas, and Mississippi.
Wonderful. Tell me a little bit about how the Mid South region differs from the rest of the U.S. in terms of breast cancer incidence, de novo metastatic presentations, and
Mhm.
mortality for Black women.
Yeah, thanks for that question. So, the Mid South region includes the Mississippi Delta region. And so the Mississippi Delta region has a disproportionately high number of what we call cancer hotspots. And so cancer hotspots refer to excess mortality and morbidity. And so that line along the Mississippi River where Memphis and northern Mississippi sit is a key cancer hotspot. So what we see is that we see increased diagnosis, late stage diagnoses, and all of the social drivers that lead to poor health outcomes, poor access to care, poor utilization in care, patient clinician miscommunication, and the host of challenges that individuals experience. In addition to things like structural vulnerability, so transportation issues, just the geography, cultural norms. And so the Mid South region is my home now, but it is an area that experiences some significant challenges for women along their cancer journeys.
Mm. And in your work, you mentioned initial factors affecting recruitment. What specific gap in the literature or practice were you trying to address?
So I think what we were trying to understand is what are the challenges for recruiting a metastatic breast cancer population, but specifically Black women in my region. So your audience might know that enrolling and or recruiting and enrolling women diagnosed with metastatic breast cancer is challenging. Oftentimes, some women are excluded from research, clinical trials, and others based on that late stage diagnosis. And so we don't always have a clear understanding of the barriers to both research and healthcare access, utilization, and receipt of services for a metastatic group. And so then we add on the challenges of systems of oppression, racism, patriarchy, uh, gender differences that add another layer of challenges. And then the regional cultural norms. And so, to answer your question, like we were trying to uncover the intersectional challenges um, that delay. No, pause. In my research, we were trying to, in this area of my research, because the access study is still ongoing, we were trying to understand the intersectional challenges to patient recruitment and enrollment so that we can have a better understanding about the lived experiences of Black women with or at high risk for advanced breast cancer.
Mhm. Can you walk us through your study design? How did you define eligible women? How did you define elevated risk? And what recruitment pathways were tested?
Right. So I'm really excited to talk about my research design. I'm a qualitative researcher by training. I'm a social scientist, and I believe we know better when we know together. So that really means that as a researcher and my staff, we wanted to understand the lived experiences, the structural, multi-level barriers and facilitators for our patients, but we wanted to know it from their perspective. We wanted to center Black women's lived experiences in their lives.